Hi Xavier. So I'm here to talk to you a little bit today about steroid injections because I don't really understand what they are, so I'm hoping you can fill me in. So please, what are steroid injections?
Nicholas, nice talking to you.
Thank you.
It's
you too.
important you ask these questions because you've been working with us for long enough and you are a sporting person, and if you don't understand commonly, many of our patients may not understand it too. So steroid injections commonly used right from the medication started or the medical world started for various other things. It is a very strong anti-inflammatory and mother of all the drugs in my opinion, and it's used to reduce the inflammation in the body, in the joints, even in the lungs if you have a very bad chest infection, and the hospitals do use it often. And many of us worry that if we're going to have a steroid, we may put on weight or it might affect the joints, it might be harmful for us. But it's actually one of the hormones produced within our body, and it helps to minimize the inflammation happens within the body. So for example, you injure your knee joint and you wait for them to get better. The body itself produces a strong anti-inflammatory within to minimize the pain and to get the healing going. After a certain time, the body gets tired and may not produce enough amount of anti-inflammatories to keep the healing going. At the same time, the inflammation will be raising and raising, and that will produce loads of pain and discomfort. This is the time we use the steroid, which is a strong anti-inflammatory, locally into the joint to minimize the pain, and so that the body, we reduce the inflammation in the area so that the healing can take place further, and we minimize the pain so people can get a quality of life and they can sleep better at night time.
Okay, brilliant. So you inject it into the joint, that's correct from what you're saying?
Yes. So the anti-inflammatories are already produced within the body that goes around all over the body, but that's not enough to target one particular joint, for example, knee joint or shoulder joint. In that case, why do we pump up enough drugs into the body all over? Rather, we use small amount of drugs locally so that we target that one joint, get rid of the inflammation so we can get on with our normal life. So we inject into the knee joint, shoulder joints, or pretty much any joints. And if you go to the hospital with this severe back pain due to disc injury or facet arthropathy, and we use the same drugs, same mechanism to inject into the spine. But we do it in the joints, any peripheral joints, maybe carpal tunnel syndrome, hand arthritis, thumb arthritis, ankle joint arthritis. We use this kind of medication to minimize the discomfort.
Okay, and would this be bad for my health if I had a steroid injection?
It's a very commonly asked question. Is it bad for us? Many people ask, am I going to put on weight? No. It's a tiny amount of the drugs we are using to put it into the joint, so it stays in the joint for a few days and few weeks and slowly work, and you can have up to 3 in a rule of thumb in a year. But if it is needed in certain other disease conditions, for example, people with the frozen shoulder, you can have more than 3. And you have rheumatoid arthritis in the knee joints or hip joint, you can have more than 3. But the rule of thumb is we don't want to inject too often. But that's the decision I make when I converse with people, find out do they have any other associated problem, is there any other illness they have, pre-existing illness. Those kind of calculations I need to make to find the right treatment for them and decide whether we could have more than 1 or 2 if needed.
Okay, and how long have you been administering steroid injections for, Xavier?
So I've been doing this steroid injections for more than 14 years now. Qualified, I'm one among the very limited number of people who qualified, being a physiotherapist, to qualify to do these injections. I was very fortunate enough to get trained by the consultants in Midway hospitals and very eminent GPs in Midway towns, and I'm an independent prescriber, so I'm qualified enough to prescribe these drugs and inject it at the same time. This is a very rare combinations you could get in a clinician, and getting the highest qualification in training and the injection and also able to prescribe the drugs, it's a very rare combination. I think I'm one among those 2 in the whole Kent to do those.
So not any old physio can administer steroid injections?
No. There are loads of risk and variation of the medication people are on. So I need to make a very careful clinical judgment so that I make sure this is a right treatment, and it is with a very limited or no side effects to the patients at all.
Okay, and are there any potential side effects from having a steroid injection?
Yes, there are loads of side effects could happen, but again, if you read the leaflet of paracetamol, you read tons of side effects, right? The same thing applies to mother of all the drugs, and it's no exemption. The first side effects you are looking for, or the risk you are taking, as like any other treatment, this injection may not work at all. It's not for everyone. It's not for every conditions we treat. People must have tried various other treatments in the past and it hasn't worked, and there is a possibility it may not work. But this is the conversation I will have with people. This is the first risk you are taking. There is a risk of anaphylactic shock, swelling of the lips, tongue, throat, rash all over the body. And if you've been allergic to anesthetic in the past, there is a possibility you may have allergic reactions to anesthetic now. In that situation, I will not use anesthetic to minimize the pain. I will use just a steroid with a normal saline. There is a possibility of infection. I'll take all possible precautions to prevent one happening, but this is one of the minimal risk we are taking. There are other side effects which are very minimal, where you might have a discoloration of the skin and a little bit of fat atrophy. Women complaints of facial flushing and raised temperature. All those things could happen. Okay, but we will be in touch with you after the injection. Just make sure everything goes as per the plan. There is a very common side effects people do experience is post-injection flare-up of the symptoms. So you come with a knee joint pain. I'm injecting this drug. For 2 days, you may have a little bit of discomfort more than what you had, but they will settle down very, very easily. And if it is so, put some ice on it, rest it, gently move it.
All right, thank you. And so why should I come to see you to get a steroid injection? Can't I just go to my GP and get it done?
Again, as I said, this is a very common question we get asked, why do I need to spend money when I can ask my GP who can do it, or my NHS appointment might come through? Again, the question you need to ask, how long am I going to live in pain? How long I'm not able to walk my grandchildren to school? How long I'm not able to sleep? How long am I going to put up with these symptoms? So as I said, not every GPs are trained and skilled enough to do this. They may not do this many number of injections every single week, and because GPs are highly specialized in various other areas, may not be in the administering the steroids. As I said, I've been doing for 14 years. I do at least 20 to 25 injections a week. And my specialty is injecting the smallest joint in the body. For example, carpal tunnel syndrome, thumb injections, and decruents, very complex tissues I inject. When I'm that skilled and I enjoy, which I do, and these major joints are pretty easy to do it.
All right. Well, thank you. Thank you very much. I think I know a little bit more about the steroid injections now.
And again, if you are in acute pain after golf, do not try to embark on an injection. Rest it, ice it, keep the joints moving. And once the body cannot do its job of healing the tissue, then we need to consider this. And if you're in any doubt, Nicola, just give us a ring and we will schedule a call, and which is free of cost, and we can talk about it. And then if I think it's the right treatment, then we can take it further.
Sounds
our
good.
phone number, 01795 60 60 66. Thank you.